All right, we're at 3:05. I'm sure that people will trickle back in as I start. So I'm just going to do a very quick wrap up, and then I'm going to leave some time for some wrap up discussion, particularly on input for some important initiatives in the province, and also for a gap analysis and next steps. So first of all, I'd like to thank our supporters and the funders in this province who have enabled a lot of the research that we've been seeing today. In particular, a lot of the research has been funded by the Michael Smith Foundation for Health Research. And we mustn't forget also Genome BC, which funded a few of the studies that were presented in this symposium, but of course has a much larger portfolio of research in other research domains for COVID-19. But I couldn't have put this together without the assistance of the Academic Health Sciences Network, the other participating universities from across the province, and of course the BC Support Unit. So this is a very, very busy slide, and if I did the roll call, it will be available as part of the larger set of slides. But there are so many people that made this possible. But I want to just do a little bit of a shout out. Kat Salvante. Kat, can you just show yourself? I don't want to put you on the spot, but I'd really like you to show yourself for everyone to give you a hand clap and a thumbs up and whatever other emoji you want to send her way. Because without Kat, this work would not have happened. She is the backbone of this symposium. Of course, with a lot of help from the SFU IT team, who has been looking after us for the last couple of days, comms people from all of the participating organizations, and an amazing steering committee that is representative of many institutions, and in particular, our patient partners on our steering committee. So thank you, thank you, thank you. And then thank you to all the participants. It's been lots of activity in the chat, lots of creative juices flowing, I think. And my presentation today is based on the work of the rapporteurs who are acknowledged on this slide, who sent me their notes from the breakout sessions. So I'd just like to remind you that of the representation that we had at this symposium. And when we considered who to put into the main sessions, it really was, there was an attempt made to be representative of research from across the province, from across the sectors in the province and across the regions of the province. We had over 800 people register for this conference. I think they came in and out. We had up to about 350 at any one time. We had over 110 speakers. So it just goes to show that the strength of this community and the interest in this community. And I just would like to thank everyone for their participation over the last couple of days at this extremely busy time of year, like right before school starts, right before university starts. Some people were still on vacation. Unfortunately, it's never a good time, but you know, I think we did something. It's a starting point. So I stole David Patrick's slide from yesterday because actually stick figures are harder to draw than it looks. And I was making an attempt to draw my own stick figures, and then I realized that it was just going to be easier to ask David for his. So we started in kind of a little bit of a space of reality checking in the epidemiology of the pandemic that we are under. And we looked at bubbles and transmission risks from the perspective of the size of your network. And we took that as the larger the size of your network, it's a negative impact for the COVID pandemic. But for us, that's not the case. If we take a network and think about it as a transmission of knowledge, the larger the size of our network, the stronger our networks, the more we lift the knowledge boat for all involved. It's important for us in the face of this pandemic to be collaborative and not competitive. And I think we really saw that come through in this symposium, that people are willing to collaborate, they're willing to share, they're willing to work together to make research happen. It's interdisciplinary, it's multi-sectoral. We have strong patient and community partnerships, and together we can have a collective networked impact. So the questions that we covered were sort of your aims of the research that people were doing. We structured it this way because a lot of the research has just been funded. A lot of the research is preliminary. So a lot of it is about what we're planning on doing. There were quite a few people, which was great, that could present some results or preliminary results, but we didn't want to put people on the spot. So it really was about what we're aiming to do, who we want to work with, what the methods that we're going to apply, what are the challenges and how can we help, and how might collaborations and partnerships overcome some of those challenges. Interdisciplinary, just incredible. I'm sure that I've missed things off this list, and you can throw them all at me in the chat. This was, me on very little sleep, so apologies if I've missed anybody's disciplines. But we had everybody from the social sciences, from the humanities, from the clinical domains. I didn't list all of the specialties, but everything from trauma surgery to respiratory medicine, family medicine, dentistry showed up today, which was fantastic. Psychology, reminding us that small acts of kindness matters. I think that was such a lovely talk to end the symposium on. Through to the health and the data sciences that are focused on epidemiology, mathematics, statistics, all of our modeling and our data for evidence-informed policymaking or decision-making. And we brought all of this to bear on developing and implementing public health measures, evaluating and understanding the impacts of those public health measures, including intended and unintended consequences. So around that, within the main sessions and then in the different breakout rooms, we really saw the diversity of settings for this research. We went from local to this afternoon to global. I couldn't believe the diversity of the settings. I was trying to put together some images. I never thought that I'd be putting an orchestra into my research settings from this symposium. But that was from today. We have a music scholar. We're working across the province with Indigenous communities, in rural settings, in urban settings, in clinical settings, in hospital and acute care settings, in family practice settings, in that blurred line now between work and home, in long-term care facilities, in schools, in post-secondary educations. The list is endless. And the populations are as diverse as the settings that they work, live, and play in. We transcend the human lifespan, from babies through elementary school education, through post-secondary education, all the way through to the end of days, or to the last phases of life. We work with patients. We work with healthcare workers. We work with priority populations, and this is a very important message about language. And I'm respectful of not putting up images when we're talking about priority populations. So representing priority populations, I've tried to do this here on this slide, just through some of the research centers that we have in the province that work with those priority populations. So we've heard about the importance and the significance and the differential impacts of women, on different genders, on First Nations, on different patient communities, whether they're COVID patient communities or they're other patient communities, and their families and their caregivers, because of course SPORE has a very broad definition of patient. And those patients and their families and their caregivers are impacted maybe because their services are impacted by a shift in focus on the pandemic. We're looking at mental health and substance use. We're looking at long-term care facilities, which was a real theme that came out. And of course, also looking at refugee and immigrant health. Shira Goldenberg was speaking in the session yesterday. Methods. The methods are as varied as the populations that we're working with. We went from everything from some really quite interventional studies in the clinical care context, through to some experimental designs that are interventional, through quantitative research that informs our epidemiology, secondary data use with health services, large-scale surveys that translate into quantitative data about all kinds of different indicators, including mental health and wellness. Exercise was a very important one for the surveys and our changes in our physical mobility from being stuck in front of Zoom for 14 hours a day. Sorry, we didn't help with your screen time this week. Qualitative data, interviews, focus groups, policy Delphi, ranged across the spectrum, mixed methods approaches, where we're part quantitative, part qualitative analyses for literature, scoping, systematic reviews, the data synthesis piece of trying to pull all of that information being generated around the world together to assist decision making and research design. Today we had talks on BC geographies around GIS and mapping and turning that into mechanisms or modes for knowledge translation. Policy analysis, critical analysis, looking at the crucial aspects of gender and race as two indicators, for example, in critical analysis. A lot of the methods are strongly grounded in participatory and community-based research. Just some exemplar studies of the best practices available for community-based research that we saw across the past few days, including in one of the opening sessions by my close friend and colleague, Cindy Jardine, who's an expert in community-based research. Arts and music, and of course, knowledge translation. But what we heard was that, particularly in the realm of maybe some of the more quantitative areas where we're doing data pulls, or we're working with specific populations, or we're surveying specific populations, there's an opportunity for greater coordination, and that we really need to think about ways, and this is the start of the conversation here, of how we can come together as a community and coordinate in the same kind of structured way that the clinical community has been able to come together for the COVID-19, around the COVID-19 cohort. The other piece that stood out for me is the extent to which the sort of best practices around the full sort of methodological domain around what we conceptualize as a learning health system, that most of many of the projects are sort of self-regulating. They have evaluation built into the research design. They have knowledge translation that includes courses and training material built into the research design. And that, because of the multi-sectoral nature of the research that we've heard about, that many of the researchers are actually in the position to implement the interventions that they're examining. And so we really need to empower those researchers to be able to move knowledge into action, and then to evaluate it and to continue that learning health system cycle. One of the highlights for me was the strength that we have in this province for Indigenous research, and how I think the research community around Indigenous health in this province exemplifies the concept of nothing about us without us. Not only is much of the research led with or by Indigenous communities, but they're led by Indigenous researchers. And that has been a real strengthening, I think, in British Columbia over the last little while. So we have Indigenous research led with Indigenous communities, led by Indigenous researchers. And that is the only way that we're going to move from a deficit or colonial lens on research, as we were reminded in the session yesterday by Angela, to a sort of a strength and resilience focus on on Indigenous health research. And then, of course, Jeff presented on the incredible work that he will be doing, bringing the national lead of the COVID-19, Indigenous COVID-19 serology study that is community-led and empowered and overseen by an Indigenous advisory circle here to this province. So that's all the great stuff. Then there's the usual challenges. So, where are the challenges? Well, the challenges are still around data and data access, the timeliness of accessing the data, being able to access the data in the first place, the availability of the data. There's issues around being able to generate data with some populations who maybe are not as comfortable in a virtual or an online research environment. And so the accessing those populations may actually be difficult, and generating survey data or interview data with individuals who are not comfortable in an online environment, or who have challenges with language and with technology and with broadband and with internet connectivity, that all can translate into difficulty of access to generate data to work with populations. That leads to some recruitment challenges that a lot of people were bringing up. The timelines and the timeliness in terms of recruitment and data points. The coordination issue I've already talked about, and I'd like to make sure that we talk about that a little bit more, and that we have an ongoing discussions around coordination. The sense that a lot of the funding has been very rapid. It's rapid response, rapid timelines, rapid putting in those grant applications, but at the same time, the grants are for really short time periods. So there's a real pressure on. It's a pressure cooker environment. When I'm thinking that, maybe it doesn't need to be such a pressure cooker, because unfortunately, from all of the epi data that we're looking at, COVID-19 is going to be with us for some time, and its impacts. This is an inflection point in our lives. I don't think that there's a now we're doing COVID research, and at some point, we're going to be doing something else. This will always be in our lifetimes an inflection point in any health data that or projects that we're doing. The funding is a concern. There's an amazing amount of research. You might wonder why I've got a desk here. It's the corner of your desk. There are so many people doing amazing work off the side of their desks, in their spare time, giving back to the community out of the goodness of their heart, who have not been able to access research funding. And I don't know that energy can be sustained over the long term, without some commitment to resourcing the really important and significant research that we've seen over the last couple of days. So, some enablers we learned about today. That was a fantastic session this morning, where I'm hoping that the researchers that were present were able to have some reassurance that there are some entities that have their back, that are there to support, that are there to provide help. So, Pop Data BC came and gave a great talk this morning. All of the things that come along with the BC Academic Health Sciences Network, through harmonized ethics, through the BC Support Unit for connections with patients and patient engagement, Clinical Trials BC, the COVID-19 research inventory, where you can look and scan and see all of those other people that are working on related issues that you can work with, and of course supports through BC Support Unit and others for KT services. And then of course there was a lot of interest in Reach BC in terms of not just for clinical research, but even for survey research and other forms of research, connecting with people that are interested in participating in research. So I'm hoping that the last couple of days are a start to conversations, and that these will continue, that you've met some people in your communities. Yesterday, for example, Travis Solway in my own faculty was chairing a session that included researchers on mental health and substance use, and they're already talking about, we all need to come together, and we need to start to continue this conversation. We need to have another half day or a one-day symposium just around specific subtopics. So I think we went broad, but I think there's a lot of room to take some of those communities from that breadth and engage in greater depth. And I hope that the way that the smoothness, I think, of the way that this ran, It was not a huge burden financially in particular. It was a burden in terms of time, but not necessarily in terms of cost. And so I'm hoping that this can be an exemplar that communities can actually come together to continue conversations. And then finally, I'm going to have Chonnettia Jones from who's a VP research from Michael Smith join me. And I'm hoping that Kelly is still on the line as well, Kelly Bernard, to reflect on some discussion questions, to assist in the development of the next round of the strategic research priorities for the province, give some feedback to our funders, including Michael Smith, reflect on gaps that might have been identified over the last couple of days, reflect, and Chonnettia is particularly interested in this, on the way that we can evaluate the impact of the research that is being done on COVID-19, and then just reflections on next steps and outcomes for the symposium. So with that, I will thank you, and I will close off the slides, and I will turn it back over to Peter to continue chairing, I think. Do you want me to?
I think you should go ahead, Tania. Go ahead.
Okay, all right. So thank you for bearing with me there. So Chonnettia, would you like to say a few words about Michael Smith's interest in the evaluation piece?
Yes, thank you, Tania. Can you hear me all right? Okay. So no, excellent summary, and it was great. And actually it really allowed me to reflect really how much, COVID-19 and what we're facing really was underscored by the importance of coordination and collaboration. And that's among, health researchers and decision makers and healthcare professionals. Really nicely acknowledged by Dr. Bonnie Henry and Dr. Joy Johnson, and showed up really strongly in the presentation and in the discussions over the last couple of days. So as Tania mentioned, we at the Michael Smith are very interested in understanding and reflecting really in the last few months in terms of what's worked and where could we have, we collectively as a province can work together better going forward. These are preliminary discussions that we're having with the Ministry of Health, led by Victoria Shuckle, the Strategic Research Advisory Committee with David Patrick and Kelly Barnard, who you heard from yesterday, and with Sterling Bryan, leading the Academic Health Science Network. Really, we're interested in evaluating the provincial research response to COVID-19 in BC. And the purpose of this is to really derive whatever insights and lessons that we can take away to strengthen coordination and collaboration across the province. We would love to take a strengths-based approach because we've heard some amazing things that have happened and worked quite well, but we also recognize that there have been challenges, so we'd like to hear about both. This is very much focused on, at least in the initial stages, on the research response, not on the public health response. And very much focused on this provincial coordination and collaboration. So, it's too early to really track research outputs. There'll be an appropriate time to do that much later. Our starting position then is that the efficient and effective coordination and collaboration is important for the provincial research response to COVID to achieve what we've heard is collective impact, and primarily for the benefit of the patients and the public. And we can't really lose sight of that. What we're really interested in hearing about are what are the conditions and the mechanisms in place that really draw and build on BC's strengths, including kind of people, infrastructure, and institutions. What's worked well, as I've said, and what do we need to put in place to really effectively support that? I'm just going to highlight a couple of questions. These are not by any means really decided, but just to give you a sense of the kinds of things that we're interested in, and certainly welcome in the discussion now any thoughts in the chat box. So please do send us your initial thoughts. The kinds of questions that we're thinking about are, what are the mechanisms that are in place for connecting researchers and decision makers or practitioners, and how effective are these? Another question, what mechanisms and conditions are in place to effectively engage the patients and the public? To what extent is provincial infrastructure in place to support a coordinated research response? What's missing or needed? And I know that Kelly's also been thinking about this and received some excellent feedback. what mechanisms are in place, and to what extent do they support the coordination of research and collaborative working. So these are just tasters, but certainly would welcome any thoughts from all of you who are tuning in now, and also to our mailbox srac@msfhr.org in terms of any questions that you think are really important questions to ask as we take this time to reflect and think about what we need to understand in order to be able to work more effectively going forward.
Peter, I think you have some thoughts.
Okay, thanks, Tania. Yeah. So this has been a great experience for me. For those of you who don't know me, I'm relatively new to British Columbia, completed about 20 months. So this was a great opportunity just to meet virtually many, many people that I'd heard about, and even many I hadn't heard about, and get a great overview of the work in public health, population health research, health systems research, and so on. I guess I wanted to share a couple of thoughts following up on Chonnettia's comments about kind of things we should think about going forward. I was a bit struck by the what I think is the situation in BC today is one in which the clinical impacts of COVID-19 probably are, for the moment at least, less dramatic on the population as a whole as the non-clinical impacts. But I was struck by some of the difficulties we encountered, for example, in digging deep and being sufficiently representative or having sufficiently substantial results, for example, about the impacts on different subpopulations. I think, for example, the question was raised earlier about whether we are adequately representing or sampling by ethnic groups or economic groups and so on. We do pull out of large surveys those covariates, but that's not the same as having representative samples. And of course, different subpopulations are distributed very differently geographically around the province. So that's one area. And the second area that I really think we could dig deeper is in this broad area of other consequences. I'm not crazy about the term unintended consequences, because in fact, some of these consequences were very much known and expected as a result of a strategy that really emphasized bending the epidemic curve and reducing the number of cases and the severity of cases. So there was a policy trade-off envisaged that there would be impacts on the population from doing this. But I do think that there's much more to be done now on really understanding those impacts and the impact of compensatory policies, economic and social policies, and so on. And this is another area where our community really could work, I think, more coherently. So then the question is, what about the structures? Chonnettia mentioned, well, what about the structures that are there? And I think that's really something we're thinking about quite a bit. Our research enterprise is very much driven by individual initiative, responding individually to funding opportunities, and producing results that get published in academic journals, for which researchers get professionally rewarded. That's great, but that doesn't automatically translate into more generalizable synthesis and conclusions. That's kind of left to some black box. And I think we could pay some attention to that a little bit better, both in terms of the funding strategies and also the part that happens after the research is done, this sort of synthesis part, the knowledge translation part. So just some thoughts from my side. I don't want to be, the sort of the negative voice. This was a wonderful event, and I am greatly appreciative of what everyone has done, but this is a time to learn and think about going forward as well. So to put those ideas out there. Thanks.
Thanks, Peter. I'm seeing a few other gaps that are coming through in the chat, and I'm seeing Sterling. I'm seeing a I think some suggestions that will be directed towards you for having I'm assuming one way to do this would be another event, something like this, but that is much more patient focused, and that would have equal time. This one was very much about, how do we get our methods together? But I think that it behoves us to also think about, how do we work better with our patient partners. The call was open. We did not reject a single talk that came in, but we received only 2 from patient partners that were speaking in the breakout rooms. So I think we should think about another event that would be more inclusive of community participants, that I think would be pitched somewhat differently. So I'm not sure, Sterling, we have some event organizers, things like Public Square and Center for Dialogue, that are much more directed around being able to host a much larger community discussion as opposed to researchers navel gazing. So Sterling, would you like to comment at all?
Sure, thanks. I think the comment is that we didn't see patients presenting at this meeting, and I think it's important to recognize that we engage patients very early on in the planning process. So we have had patient and community engagement in the planning of this conference, and I think, if I was to, if we could be Doctor Who and we could go back in time, we might now do things a little differently, of course, but we can't do that. So I think you're right. I think what we need to do is think. We've made great progress in BC and in Canada and actually internationally in this space of patient-oriented and public-oriented research, and there's no going back. Like we're not gonna backslide on that. Period. Like it's a culture change that's happened, and it's for the better. And I'm embracing it fully, and I know that many colleagues in BC, research colleagues in BC are. So I think we just need to recognize that. And I do think I like the idea now of actually having a patient and public focused event, but with researchers as well, and with policy. I think it's about the stakeholders coming together, but actually listening effectively to the voices of those with lived experience. It's absolutely what we should be doing. And yeah, just to say again, there's no sliding back on that. I'm not going to let that happen, and I think everyone else here is committed to not letting that happen as well. But we need to learn, and we need to recognize that there are areas that we could strengthen.
Yeah, I think that's a really good summary, Sterling. I think we can move forward to a partner event, and would be happy to help. I also think that now we're at a point where we have an identified COVID-19 patient cohort of people with lived experience of various severities of COVID-19 who have been consented as research partners and patient partners in research. And so I think when we were planning this, that was just, we hadn't even gotten to that point yet. And so certainly we now have a population that we can reach out to. The other question that we have in here, which I think is very important, that I think that one of the things that really came through in this event is our issues around long-term care, our seniors, about advanced care planning, about all of those issues that are related to the age of our population and our care for our elders. So I think trying to plan something around that, I think would also be, I'm going to put words into your mouth, Victoria, but I would not be surprised if that would be something of significant interest to the ministry. So I think Kelly's heard that as a strategic research priority loud and clear. Kelly, did you want to comment on some of the priorities that you were, before I turn it over to Victoria, would you like to comment on some of the priorities that you've been hearing?
There we go. Yes, thank you so much, Tania. This has been an amazing couple of days. What a wealth of information and knowledge and expertise, and people's willingness to come forward and discuss and talk about collaboration is amazing. I think we've had a really great chance to shine a light on the research environment in BC. And what we're seeing is pretty good, but it's also shining a light on some issues that may have arisen for researchers. And we're very interested in making sure that we're supporting people to do the best they can with the timelines and the constraints, but also the opportunities that are arising as a result of the funding and the approach that people have taken to this problem. We are seeing unprecedented levels of cooperation amongst researchers and a real willingness to bring together information and resources and share methodologies and so on in a way we really hope for. And I would hope that that's a continued legacy of the work that people are so tirelessly undertaking right now. So I would really love to hear from people about how they feel in the research environment in BC, and how indeed have we made the best of our assets? Have we? Are there remaining gaps or impediments that people are facing as they try and approach their research? And are there opportunities to think about research in a different way as we go forward, and thinking about opportunities for different approaches to collaboration within teams, cross-disciplinary, cross-institutional, and how can we do that meaningfully as we move forward? So I would really love to hear from any of you with respect to your ideas about how we take a strategy such as this forward, and how we learn from shining a light with this particular focused issue on the longer term needs and capabilities of our research system. So please feel free to contact me. I've sent the email link is there, the srac@msfhr.org, and correspond with us at any time about these things. We're vitally interested in your experience and your input into this.
Thanks, Kelly. Victoria, did you want to say a few words?
You know, the only thing that I wanted to say, thanks, Tania. I wasn't expecting to say anything, and I won't. I think that what you have said and what Kelly said was great. The one piece that I would just comment on, I'm just so thrilled to have listened to a number of the different studies and to hear how far along, even if the study's not complete, just how much information is being generated and is in people's hands right now. And I hope, I sent you a note earlier, I hope that we can talk to the symposium participants and ask for their support in providing some of the linkages. Maybe, I don't know if it works to actually do it directly in the inventory, but if there's some way that we can capture the links that in some cases people were providing in the chats, in other cases in their slides, if that can actually be centrally pulled together, that would be, but I just feel like it's been a really rich 2 days and very, very appreciative.
Thanks, Victoria. I'm hoping that the participants from the various government ministries feel enabled to connect with any researcher that they feel is doing work that is relevant to questions of specific significance, or things that they're working on, or stuff that they would like help with. I'm hoping that, you know, there's been a little bit of behind the scenes matchmaking going on between significant research questions and researchers that are working on them in the province. So I think I'm not seeing a lot more. I think that everyone's brains are probably fried. I know that mine is. It's been an amazing couple of days. I do undertake to pull together a bit of a summary with the steering committee for the workshop. I'm hoping that we can find a way to connect people that want to be connected. We do have everybody's emails. We don't necessarily have consent to share them all, but I think we can share at least the main speakers. They shouldn't be too hard to find. But if other participants want to specifically connect with individuals that they can't find an email address for, do reach out for us and we can ask for permission to put you into touch. We will also undertake to go through the chats. We've been saving them to pull all of the resources together and put together a resource page that we can give to Academic Health Sciences Network to post with the main sessions when they become available on their YouTube channel. I think that will be helpful. Yeah, Sterling. Yeah. And if you missed anything and you want to go back and look at anything, the main sessions were recorded and they will be posted. And so with that, Bev, is Bev on the line? I just wanted to thank Bev and Michael Smith so much. Chonnetta's here, but we're so lucky to have such an active and supportive funder in this province. Not every province has one, and certainly the resources that are distributed through the Michael Smith Foundation for Health Research enables a lot of the fantastic work that we've seen over the last couple of days. So
Tania,
thank you, everybody. Yes.
Can I just, so we do have Putting Patients First, which is our virtual conference happening on October the 8th for the BC Support Unit. It's not focused on COVID exclusively, obviously, but I think it is a place where conversations could continue. So and all stakeholders would be welcome and be participating in that event. So yeah, I just wanted to remind people of Putting Patients First.
Thank you so much, Sterling. That we'll circulate the link to that as well. All right, thank you. Goodbye, everybody.
Thanks, Tania.
For those of you who are in the post-secondary sector or sending your kids to school, good luck with the start of the school year for big and small, and we will see you later.